Mr. President, as of today, there are over 1,000 confirmed COVID-19 cases in 35 states in Washington, D.C. The World Health Organization has now declared COVID-19 a pandemic. 31 people have died in the United States already, and because of this virus, already this includes one person in the state of New Jersey. Communities across the country, most recently in New Jersey, are confronting the possibility of seeing a spread of this virus. We also know that it's possible, due to delays and lack of availability of testing, that the actual number of those infected here in the U.S. is likely higher than what has been reported. Every day that passes during the spread of this virus, every single day, every single hour, every single moment is critical. We must act urgently to slow its spread, to mitigate its impact. We all have a role to play in fighting the virus, each and every one of us, from our personal hygiene habits to those of us who are in positions of authority, and the roles we can play to protect each other and protect our communities. And one of the most significant ways to do this is actually by encouraging people to stay home. Members of Congress have self-isolated themselves. People who have symptoms or who have severe cause for that they may have been exposed, there is an importance in social isolation, staying home when you're sick. The challenge, though, for us as a country is that for millions and millions of Americans, this idea of staying home is not an option. Tens of millions of Americans know that if they stay home, they miss a paycheck. If they miss a paycheck, that can mean financial devastation or ruin for their family. We are now the only industrialized nation in the world that doesn't have paid family sick leave for workers. This is an unwelcome, and unfortunately, this is a dangerous distinction now in the time of a global pandemic. And this literally punishes people who are struggling, low-income workers. Right now, the choice for millions of Americans is really this: choose between your next paycheck and caring for your sick child. Choose between going to work sick or having to skip a meal. Choose between your health and well-being or your family's financial security. That choice, unfortunately, before even this pandemic, this was a choice that many Americans knew, that the people that are handling our food, the people that work in our restaurants, the people that work with our elderly often go to work sick in this country, helping the normal flu spread, helping other illnesses spread. Well, in the case of a pandemic that has a mortality rate of potentially 5-10 times that of the flu, this is unfortunately a tragic choice that families are trying to make. According to the National Partnership for Women and Families, 70% of the lowest income workers do not have a single paid sick day. They also report that 81% of people working in the food service industry, let me say that again, 81% of people working in our food service industry and 75% of child care center workers do not have access to paid sick leave. And this is disproportionately seen in communities of color. So think about this, the choice you would make. Your child is sick, you are showing signs, but you know if you do not go to work, you will not be able to make rent, you will not be able to keep food on the table, you will miss a car payment, which means that you might have your car repossessed. These are impossible choices that don't just put that family in crisis, they put us all at risk. The disparities in access to preventative care are also an issue. There are disparities in access to preventative care and health care and affordable medicine for people all across our country, millions and millions of people. This is already, before a global pandemic, it's already a health crisis. The continued and unmitigated spread of COVID-19, though, could have disastrous impacts on people and communities that already have this vulnerability. In my community, where I live, where I'll hopefully go home this weekend, in Newark, New Jersey, the median income for the census tract I live in is about $14,000, according to the last census. $14,000 per household. And I know that public health emergencies can quickly become economic disasters for those who are already struggling at the economic margins of our country. As we work together to combat the spread of this virus, we need to remember that any of us are only as healthy as our most vulnerable neighbors. In other words, what Martin Luther King said years ago, he said, injustice anywhere is a threat to justice everywhere. Well, the virus anywhere is a threat to the health and safety of us everywhere. That is why we need to act urgently to pass the bill introduced by my colleague, Senator Patty Murray, to guarantee 7 days of sick leave for all workers and critically guarantee 14 days of paid sick leave during public health emergencies. That is an act of self-interest. Again, I know with over 80% of those who handle our food in restaurants, of those folks who do not have paid family leave, they are now economically incentivized to go to work sick. That could cause a greater spread of the virus. Paid sick and family leave is a public health and safety issue, plain and simple. It's about economic justice and economic strength and security, but it is a public health issue for us all. As we prepare to fight this virus, we need to do the things that keep our people, our communities, our country safe, healthy, and strong. That means joining with the rest of our industrial nations and having paid family sick leave. That means opening up and modernizing the Unemployment Insurance Act, because workers who lose a paycheck because their factory closes or their restaurant closes or they lost childcare should be able to access the critical benefits they need to help their family get by. And that means we also expand SNAP benefits for those kids who are forced to stay at home and from school and may miss meals. To take on this virus, protect all of our communities, to ensure the strength of our economy, to ensure our health, we need to take a comprehensive and inclusive approach. That means leaving no one behind, because we're all in this crisis together. I have seen challenges from 9/11 to when I was mayor and we had Hurricane Sandy hit. What was the strength of our community, that region around 9/11, was strength of our community during that terrible storm. I remember seeing the strength was that we stood up for each other, we stood by each other, neighbors opening up their homes, people lending a hand, people showing sacrifice for each other. That's the American way. Those values, those virtues should be reflected in our policy. We are weakened right now. We are more vulnerable right now because we do not have common sense policies other countries take for granted, like paid family leave. We, as the United States Senate, should act for love of country, for love of each other, for the strength, security, health, and well-being of us all. Mr. President, I yield the floor.